Hello everyone, my name is Minjae Kim. I'm a part of the Movement Disorders Division at the Department of Neurology at the Johns Hopkins School of Medicine. Here I will discuss a study on the modulation of impulsivity from deep brain stimulations on the Globus Pallidus Internus. Impulsivity is a multifaceted behavioral manifestation that includes a preference for smaller immediate rewards over larger delayed rewards, or a failure to inhibit prepotent motor responses or aggression. So there are different phenotypes of or subtypes of impulsivity. So in which the scope of our study will cover motor impulsivity, which is a failure to inhibit one's prepotent responses, and decisional impulsivity, which is a preference for a smaller immediate reward over a larger delayed reward. While the manifestation across different subtypes of impulsivity is highly various, the neural substrates of impulsivity is generally known to be implicated with the abnormal connections or changes in dysfunctional neuromodulations between the basal ganglia nuclei and the prefrontal cortex. So therefore, the ability to intervene in the functional communication between the PFC, the prefrontal cortex, or the BG, the basal ganglia, a pathway via neuromodulation may be associated with a change in this impulsivity severity. Uh, the best tool to investigate this question is utilizing the deep brain stimulations or DBS. So DBS is commonly it's already used for advanced therapies to treat motor symptoms of Parkinson's disease or dystonia patients. However, DBS is also suitable for the study by controlling by its ability to control the degree of neuromodulations on the targeted basal ganglia nuclei by programmable stimulation voltage, pulse, and frequency. Here we investigate on how the neuromodulations of degree of DBS on one of the common DBS targets, the globus pallidus internus, GPI, or specifically the region of the GPI that sends projections to the PFC that is implicated with impulsivity on the motor and the decisional impulsivity. Um, this is a schematic on the DBS electrode placement and the stimulation parameters. The green structure shown is the GPI, and the blue substructures within the green GPI, it is the PFC-GPI, which is part of GPI that sends projections to the prefrontal cortex. And then this white noise that is circling around the contacts, those are the electrical field generated from the activated electric contacts. And then its intensity it exponentially decays when moving away from this contact sites. And the red bulb is it is called the VTA, the volume of tissue activation. So these are the regions that's when the tissue are sufficiently stimulated from the E fields. So when they're activated, then here the VTA or the actual size of the VTA can be parameterized by the delivered stimulation strength. So the increase in voltage or the current of stimulation can actually increase the volume of the VTA. So in order to differentiate the effect of stimulation between the PFC-GPI and then this non-PFC-GPI, which is basically the other regions, other green part, the green region of the GPI, we observed that the VTA is actually located distant enough from the PFC-GPI, so that the intersecting volume between these two regions are virtually zero. So taking this into account, we could isolate the effect between the PFC-GPI and the predominantly non-PFC-GPI, so that for the PFC-GPI, we observe the Euclidean distance between the outer edge of the VTA and the center of the PFC-GPI, so that the further the distance is, we can infer that the effect of stimulations on the PFC-GPI it is diminished due to the exponential decay from the E field generated from this contacts. Now for this predominantly non-PFC-GPI, we observed that the volumetric intersection between the VTA and the GPI, so that the higher the intersection or more the intersection, there will be a higher effect of stimulations on that region. Uh, Here, since the scope of our study will be looking into the motor impulsivity and then the decision impulsivity, we introduced this task called the stop signal task to first evaluate the motor impulsivity. The general setup is that there will be a goal cue present. So this is when the participant will be asked to respond by pressing a keyboard as soon as possible. And the time taken between the presentation of this go cue and the actual motion made to press the button, that reaction time is labeled as the go reaction time or the go RT. Now, about for random order, about 33% of the trials, there will be an occasional stop cue that actually pops up after the go cue is presented. And this is when the subject or participant will be asked to inhibit their movement in it as they were asked to initiate as a response to the go cue and not press the keyboard. And the reaction time taken between the presentation of the stop cue and then actually stopping their prepotent motion, it is labeled as the stop signal reaction task or the SSRT. So uh, the the physiological significance is that the shorter the go RT, it implies a faster movement initiation and movement reaction, and then the shorter SSRT means increased ability to inhibit one's motion while pressing the button, so that it results in a reduced motor impulsivity. Now, to evaluate the degree of decision impulsivity, we introduced this Iowa gambling task or IGT. So in this test, there are four types of decks present on the computer screen, and these participants will choose one deck at a time across the 100 trials. So with every choice, they will win some money, but occasionally they will have some penalty associated with that card, and then they lose money. So like I said, there are four decks of cards, and then deck C and D are considered advantageous, which means that they will have an ultimate net gain of money. And then there are some cards that are, in this case, deck A and B, they're considered advantageous because they actually result in ultimate loss of money. The main difference between deck A and B is the frequency of penalty. So choice of deck B results in more frequent penalty than deck A. So its negativity and its the disadvantage is more apparent than deck A. So here so deck B is considered a low conflict condition, and then deck A, which is with its negativity is masked and then it's more subtle, it is considered high conflict. So, however, regardless of both deck A and B, they're both considered disadvantageous, like I said, because they both result in ultimate loss of money. Here, we initially addressed that the increase in decision impulsivity is increased with the percent choice of a bad deck. So a choice of either deck A or B. For this study, 7 subjects with Parkinson's disease who went bilateral GPI DBS electrode implantation were recruited, and their demographics is reported below. Their mean age was about 63 years old, and with approximate 13 years of PD. Their mean EPDRS part 3 scores are approximately 33, and then their MoCA, the Montreal Cognitive Assessment scores, are about approximately 27%, about 27, not percent. I also want to point out that most of the participants for their study, across 7 participants, were mostly right-handed. So this is the this shows the result of the correlation between the PFC-GPI and the VTA distance and the GPA volumetric overlap and the overall difference in GO-RT, the goal reaction time between DBS on and DBS off. Okay, so recall that the higher PFC-GPI GPI VTA distance is there's a reduced stimulation effect, and the higher go RT means that there's a reduced reaction time from movement initiation. The correlation of the right PFC GPI versus go RT was significant. So here, higher stimulation of the PFC GPI was associated with a faster movement initiation. In this case, the correlation between the left PFC GPI and the go RT was not significant and was not shown in the slides. But for the left non-PFC VTA, and the VT intersection, which it translates to a larger volumetric intersection, results in higher stimulation effect. We observe a positive correlation with the GO-RT. So this suggests an opposite effect as the PFC-GPI, as we increase the stimulation on this predominantly PFC-GPI, we actually do see a decrease in reaction speed and slower movement initiation. Like I said, it's an opposite trend we observe for the PFC-GPI. Here, the correlation between the right GPI and the VT intersection and the GO-RT was not significant and was not shown in the slides. The same right PFC-GPI distance analysis was repeated for the SSRT. Here, just as a recap, higher SSRT means higher motor impulsivity. So with the increased PFC-GPI VT distance, which is less stimulation effect, it is associated with a higher SSRT. So thus increased motor impulsivity. So the higher stimulation would be associated with reduction of motor impulsivity conversely. But for the left non-PFC GPI and the VT intersection, which larger the volumetric intersection means a higher stimulation effect, we observe this positive correlation with the SSRT. So so as we increase this stimulation on this predominantly non-PFC GPI, we see an increase in SSRT, a reduction of motor inhibition, and therefore an increased motor impulsivity. So reviewing the GO-RT and the SSRT correlation, we do see an opposite trend between the stimulation effect of the PFC GPI and the non-PFC GPI in terms of GO-RT on motor movement initiation and SSRT, the motor impulsivity. Here we explored how the percent choice of disadvantageous decks A and B to assess the degree of the decision impulsivity and its associated degree of the stimulation between the left and right and left PFC GPI distance. Here the change in decisional impulsivity following the DBS and its effect on the PFC GPI was studied by similarly as the GO-RT study, how correlating the PFC GPI VT distance and its change in proportion of choices of the advantageous deck between DBS on and DBS off. Here, as you can see from the slides, the results of the analysis was not significant. Instead, here we consider whether the degree of disadvantageous decks may be dependent on the varying magnitude of this advantage. So like I said, the deck B yields more apparent negative outcome over deck A due to higher frequency of penalty. So it is comparable that deck B is more suited or it represents a more low conflict situation, whereas deck A it results to a more high conflict situation. Here, choice of deck A was associated with more subtle negative outcome, and then here in the correlation analysis, we do see a strong negative correlation observed for the both right and the left PFC VT distance. No significant correlation was observed for deck B only, which is like I said, it translates to more with less subtle and more negative and low conflict situation. So from our results, we do see increased DBS effect on the PFC GPI selectively. It is associated with first increased motor impulsivity by improved motor impulsivity by increased motor inhibition and then faster movement initiation with lower GO-RT. And then notice that we do see an opposite stimulation effect between the PFC GPI and the non-PFC GPI. Now for for decision impulsivity using the Iowa gambling task, we didn't see a strong correlation between the PFC GPI and then the degree of decision impulsivity, which was either for the high and low conflict, but we do see a strong correlation between the PFC GPI and specifically for the high conflict of this advantageous deck in here deck A. So as we've seen this negative correlation, it means that selective stimulations or increased selective stimulation on the PFC GPI actually is associated with increased decision impulsivity. So it is quite interesting to see a contrasting stimulation of the same region results in contrasting behavioral effects between two impulsivity subtypes. Thank you.